Hi, my name is Dr. T.K. Gossett, and I'm here today to share some information with you about my knee pain recovery program. If you're watching this video, more than likely you or someone you know is suffering from chronic knee pain. Now, what's my degree, qualifications, and experience? In Illinois, I'm licensed as a chiropractic physician. Because the state of Illinois respects the education that I have, understanding it to be equivalent to a medical doctor's education, the only difference being that we don't study drugs or surgery, I am licensed as a physician. So in Illinois, chiropractic is the practice of medicine in all its branches without the use of drugs or surgery, and that's by choice. Now, in addition to the basic medical or chiropractic education, I have extensive postgraduate study in orthopedics, neurology, and internal medicine. I'm board eligible in orthopedics. I have 35 years experience in practice as well, treating chronic and severe conditions like knee pain. So my practice is focused on chronic and severe conditions. So I have a chronic condition practice. My mission is to crack the code to your chronic and severe condition. In this case, we're talking about knee pain. Most patients have been to multiple doctors, be it their primary care physician, an orthopedic surgeon or orthopedist, neurologist, maybe an endocrinologist, and maybe an arthritis specialist as well. The types of treatments that they've been recommended, I should say you or the person you're concerned about has been recommended, would range from over-the-counter medication, prescription medication, to even narcotics. We've had patients on all these ranges have, as a result of the care they receive here, had their medications reduced or eliminated along with their pain. In addition to medication, oftentimes patients have been, like yourself, have been recommended physical therapy. They may have also been recommended injection therapy to the joints or the soft tissues around. Now, if those didn't work and the pain is persistent, oftentimes patients will say, am I a surgical candidate? And the doctors will oftentimes hold the patient off and say, we want to wait until the absolute last point in time that we could do surgery, because we don't know how you're going to respond to the surgery, and the surgery, the joint replacement or the surgery response may not last forever. You may need those joints replaced again sometime in your life. What about people who have had surgery and are still having problems, particularly not just the cleanups that go in to remove arthritis and that type of thing, but knee replacements, and they're still having knee pain? That's a little bit of a head scratcher, isn't it? Well, it's obvious it wasn't just the knee if they're still having knee pain after a knee replacement surgery, right? So let's move ahead and demonstrate how I'm different. Now, how I approach knee pain is what makes me different from these other doctors. What I do is conduct a thorough history and a thorough examination, not just a cursory history and examination, but a thorough one. Now, what's involved in a thorough history? That's looking at events and conditions that developed, symptoms that developed weeks, maybe days, weeks, months, years, or even decades previous to this time that could contribute to your knee pain. Now, the major cause of knee pain is inflammation. So the key is to find out what is causing your inflammation. And oftentimes it's a number of things, not just one thing. So let's look at common causes of inflammation and knee pain. From an orthopedic standpoint, obviously accidents and injuries are involved and contribute to knee pain. Mechanical and postural misalignments. Maybe a person is knock-kneed, or maybe they're bow-legged, or maybe they have flat feet, or maybe they have a hip problem or a back problem, or maybe they have actual misalignment of the cartilage or different bones in and around the knee itself. Maybe there's wear and tear that's contributed to repetitive or from repetitive stress. Things like standing a lot, walking up and down stairs. Many of you have had jobs or recreation that caused repetitive stress, twisting and turning, being on your knees a lot, up and down a lot. That results in inflammation, degeneration, and then disability. What about surgical complications? Well, we hate to see this happen, but at times, due to surgery, patients don't respond as well as we would like. Maybe they develop some type of complication from the surgery itself or continue to have problems. What about some uncommon causes? Those are more than likely due to neurologic or internal medicine or metabolic type of system problems. From a neurological standpoint, there are several different types of neurological diseases that either refer pain to the knee or cause the knee to be used in an abnormal position, which puts stress on the knee. Two very simple examples would be sciatica, which causes pain down the back of the leg and into the knee. Another would be the lateral compartment syndrome in and around the knee itself. Entrapment syndromes, where the nerve is being pressured. Another uncommon cause is autoimmune reactions. An autoimmune reaction is very simply where the body is accidentally attacking itself, thinking that these body parts are antigens or foreign substances that need to be broken down and rid from our body. Well, good examples of causes of immune reactions for the knee are conditions like rheumatoid arthritis, lupus, and even a condition called gastrointestinal permeability conditions like leaky gut contribute to increased inflammation that affect the joints. Let's also look at hormone imbalance. Well, how could that have possibly affect a knee? Well, let's look at what two organs themselves contribute to this. If we look at the adrenals kick out cortisone. Well, guess what? What are many of the medications that maybe you've had yourself taken, medications or injections, contained what? Cortisone. So if your adrenals are not working properly, guess what? You don't have the right cortisone levels, and there's no way you can control the inflammation that's in your knee. What about the pancreas? Well, the pancreas is necessary for kicking out insulin, and insulin helps regulate our blood sugar. If your blood sugar is too high, the healthy range is between 85 and 100, not 110, 125, between 85 and 100. Anything over 100 creates inflammation. Inflammation puts pressure on the nerves. That can affect your knee. Also, anemia. If you don't have enough red blood cells, or if they don't have enough iron, they're not bringing sufficient oxygen into your knee. So as a result, you have less oxygen, then you have inflammation, then you have degeneration and disability again. What about nutritional deficiencies? Well, very simply, there are thousands of chemical reactions that occur in and around your knee every day. And those chemical reactions occur in order. And it's necessary to have all those nutrients or chemicals in your body and readily available. If they're not, then what happens is a breakdown in those chain of events, and then those other chemical reactions have no way of occurring, and then you have not only knee pain, but you have a lot of other symptoms and conditions that can result as well. Now let's look at how I'm different with a thorough exam. I approach it from an orthopedic standpoint by checking joint alignment, joint stability, the range of motion, your ability to move in full range of motion, your deep tendon reflexes of the lower extremity, and muscle strength of the lower extremity, and in particularly those muscles that attach to the knee. Now, I also look at it from the exam from a neurological standpoint. I look at the muscle tone. It should be equal front to back, side to side, and left side compared to right side. Your sensations are checked: light touch, deep touch, hot, cold, vibration, and many other, and sharp and dull. Those should all be normal. If they're not, then there's some neurological component to your knee pain. I also test your balance, coordination, and proprioception, or your sense of where your knee is at. So all of those are necessary for your knee to function normally and for there to be no stress in the knee joint itself. Now, then I also look from a metabolic standpoint as well by looking at any and previewing any previous lab tests that you can make readily available for me, by filling out a metabolic assessment form which goes through the different systems and red flags any areas that may be contributing to imbalances that would cause inflammation, and specifically cause inflammation in your knee. If that's the case, if those are positive or finding abnormalities, then I may recommend some additional lab testing at a deeper level to differentiate what's going on and how that could be contributing to your knee pain. Does that make sense? So, as we look, patients, as I look at a patient, everyone is on a continuum from health to symptoms with malfunction to symptoms with disease. Somewhere along that continuum, you or the person you're concerned about, and the reason you're watching this video, is on. Now, the treatment protocols then, like the exam, look at the situation or the condition from an orthopedic, neurologic, and internal medicine or metabolic aspect. Now, the more complex it is, the more of these systems are involved. If it's a simple problem, then a simple solution is readily available and has probably been successful. If not, then yours is probably more complex, involving 2 or more systems. The more complex it becomes, the more multi-dimensional it becomes, and the more difficult it is to figure out exactly what's going on, what's causing that, and what's going to help get that situation or that condition better. So your regime of therapy that I would recommend may range from regularly scheduled office visits with limited to extensive therapy, or limited visits with extensive, or limited to extensive therapy, possibly even with home therapy as well. So let's look at the treatment protocols from an orthopedic standpoint. What I do is work to mobilize and balance and position the joints properly, then support them properly. This may take some mild adjustment procedures that's done very carefully and with a very light force. Also, support may be necessary, whether it's in the arches, whether it's in the knee, whether it's in the lower back or hip, if that's where it's coming from. If there's any kind of joint breakdown, there may be some compression of the joint. And so if that's the case, then there may be some decompression therapy that's necessary. In decompression therapy, there's a specific type of high-tech traction that's used to decompress the joint, which creates space, and it creates a vacuum to pull the water, the serum, the sugar, and oxygen into the cells, as well as white blood cells, to help that joint heal to its maximum. It also stretches the muscles that are too tight. It also stretches ligaments that have been injured and broken down in this situation. Normally, the ligaments are very tight like this, like elasticity, and they stretch to allow movement and then come back. Well, if there's been an injury or a breakdown of the knee due to repetitive stress, those ligaments are stretched and scar tissue in here. So you have ligaments that are too long and joints that are too mobile, very unstable. What this does is break down that scar tissue and stimulate type 4 collagen to go in there, which is stronger than the original type 3 you're born with. And so as a result, this is more stable. So decompression therapy. Cold laser therapy is often utilized. Laser therapy has been found to be very effective in helping to stimulate the healing process. Far infrared heat has been utilized here at this office for well over a year, and the new research shows that it is very effective in increasing the circulation of the white blood cells, the red blood cells, everything else that's necessary, infusing these areas with circulation to stimulate the healing process as well. Now, electrical stimulation may be necessary as well, either for inflammation or for muscles that have atrophied or lost their tone due to misuse of the knee or not being able to use your knee. Or another form of electrical stim may be utilized to actually stimulate those muscles in such a way to get them to relax. So there are 3 different types of electrical stim that are used. In fact, there's one more type that is used to help the nerve endings in the knee or in the foot, somewhere in the lower extremity area where that's been interrupted when that's necessary. Now, from a neurological standpoint, what I work to do is reestablish normal brain, spinal cord, peripheral nerve, and receptor cells or endpoint cells. And this is done with a very gentle stretching technique that reboots the central nervous system from the brain to the spinal cord, peripheral nerves, to the nerve endings. Then we use this electrical stim I was talking about a minute ago to actually stimulate the nerve endings either in the feet or in the lower leg area or in the knee or upper leg area, wherever that's the problem has been discovered. And what that does is stimulate and activate those nerves again, wake them up. They've been in a sleep cycle and just not working properly. Once they're activated, then it activates the whole system to the brain and back down. I also utilize exercises to help with balance, coordination, and proprioception of the knee. So the positioning of standing, you should be able to stand still, erect. You should be able to balance yourself. You should be able to move slowly. You should be able to smoothly be able to stand up, sit down, go up and down stairs with no hitches or problems and limping and that type of thing. And we work with patients on that. As well, being able to know exactly where your knees are, being able to sense that it's good and stable, that it's not going to give out on you and collapse on you. Many patients will say, I just feel like my knee's going to collapse on me. I can't trust it. And that's what we're talking about, improving. Now, from a metabolic aspect, the protocols, it's necessary to eliminate any infection, whether it's systemic or local, to evaluate and balance the body's pH. Here in America, we tend to be more acidic, and that sets us up for primary for all kinds of degenerative disease processes. And so what I do is work to get that pH back to neutral, which is a much healthier environment for your body to function in, which helps minimize, if not prevent, disease. Also, we look at balancing your blood sugar, balancing your hormones like the cortisone, the insulin we talked about, balancing the anemia problem by increasing the red blood cells or increasing the iron in the blood so that you're getting as much oxygenation as possible, and then making sure that cardiovascular-wise you have good circulation throughout your system. Now, it's also important to, as we talked before, decrease the systemic inflammation, which results in degeneration. And it's also caused oftentimes by an autoimmune condition. So an autoimmune reaction is a result of inflammation as well. So the last thing that we look at is, from a metabolic standpoint, is instituting dietary changes to eliminate foods and chemicals that are inflammatory to your particular system. And everybody's different. Then once that is done, it's necessary to determine if you have any nutritional deficiencies, because again, we need to make sure that we're providing all the chemicals and nutrients that are necessary for all of those chain reactions that normally occur and to continue that order in regular order. So the treatment goals from an orthopedic standpoint are for the maximum alignment, stabilization, range of motion, and muscle strength. From a neurological standpoint, to maximize the sensation, the control of the nerves, and the muscle tone. From a metabolic standpoint, it's to stabilize the internal body chemistry. And if we do all those three things, when necessary, inflammation goes down, and guess what? Your pain is reduced or eliminated. So if we look at your condition overall, it may be orthopedic in nature, it may involve the neurological and the internal medicine aspect, or it may be internal medicine in nature and and be involved with these others as well. Well, what if all of these are involved? If it's a simple problem of a metabolic problem, then the medicine is very easily going to take care of the problem. If it's orthopedic, then the physical therapy or the surgery is going to take care of it. If it's neurological, then whatever a neurologist would recommend, be it medication or some exercise, special type of exercise, may help. But what if all three of these are going on? What about this area right here where they all overlap? That's very difficult because you would need three different doctors working together very closely in a coordinated way and understanding all the different aspects to be able to get you better. And here's how I'm different. Because I have postgraduate training and 35 years experience in doing this, I step here in the middle with you and essentially send a general with an army in this direction, and that direction. As a result, your inflammation level starts to go down and your symptoms start to go down. The more we're able to reduce the inflammation, the more you do what I tell you to do. If you follow my instructions, you will get better. It's that simple. But you do have to follow my instructions. The more we reduce your inflammation, the fewer symptoms you'll have. So what's next? You know who I am, you know how I'm different, and you know what to expect once you come to my office. So what's your next step? Well, for those of you who already have an appointment, I look forward to meeting you, and I look forward to working with you, and I hope I'll be able to accept your case and help you get better. What about those of you who are searching and looking for solutions? I'm glad you're here watching this video, and I hope it's been helpful. And I want you to know that you're welcome to look throughout our website here and see what else is available and how we approach things differently. And I also want you to know that you can look all you want, you can study all you want, you can talk to all the people you want, but nothing's going to happen until you take the right action. And you have to take action. So the action you need to take is to get our phone number off our website, call and ask to speak to our new patient coordinator, and she will interview you and she'll screen you as to whether it looks like yours is a condition that I could consider taking on. If so, then she'll schedule you for an initial consultation and examination. She'll send you some forms to fill out. Those forms will give me the information I know to get to the core of your problem and help your condition. So that concludes my video on knee pain recovery, and I want to thank you for your time.